Welcome back to Ponea TV. My name is Caleb Ngare. I'm a clinical management trainee at Ponea Health. In this segment, we are going to discuss more about the presentation in terms of the signs and symptoms of chronic kidney disease, as well as the various diagnostic measures that we have for chronic kidney disease. With me is Dr. Albert Chesire, who we have been having a discussion in the previous segment, where we talked about a brief introduction of chronic kidney disease. We have talked also about the various patterns and spread of this disease. We have also spoken about the various causes and the various stages of this disease. So Dr. Chesire, people always talk about signs and symptoms. What would be the difference between these two?
Yes, thank you very much, and welcome back our viewers. So yes, a sign, or rather the difference between a sign and a symptom is that a symptom is what the patient, you as the patient, will tell us as the doctors. So you may complain of a headache, an abdominal pain, maybe a diarrhea. That will be a symptom. Whereas a sign is what we as the doctors are able to pick from you. So for instance, if you're having a swollen abdomen and you're able to pick up that there's fluid, then that will be a sign.
So in short, we are saying that a symptom is more subjective, whereas a sign is more objective.
Yes,
okay.
Precisely.
So in terms of the various functionalities of the kidney that we discussed in the previous segment,
Okay.
If the kidney is ailing, if the kidney is diseased, that means that certain aspects of its functionality are not working. So how does that relate to the various signs and symptoms that present in chronic kidney disease?
Yes, I think from the various functions of the kidney, the patients will have different manifestations. The kidney, as we know, is an organ responsible for a clearance of excessive fluid from the body. So typically, these patients will present with fluid overload, or rather swelling at various points of the body because of fluid retention. This may present in terms of facial puffiness or swelling of the face, swelling around the abdomen, swelling around the legs and the feet. The swelling typically is worse in the morning when they wake up, but progressively gets better as the days move because of gravity. In some instances where you're having the same fluid accumulating within the chest, or rather the lungs, they may have symptoms of difficulty breathing. Secondly, if the fluid accumulates in the abdomen, they may have issues with abdominal pain, some bit of discomfort, and because of the location of the kidney, some may complain of pain on the sides, where we call the flanks in the abdomen. The other common symptom is a change in the urine patterns. Patients may notice that they are either not producing urine totally, they are producing urine with blood, or they are producing excessive urine. This is relatable to the ongoing damage in the kidney, and in some instances, because of the decreased functioning of the kidney, you're having now reduced urine output. Other common signs will be signs relatable to the skin, where they may have a dry skin, some bit of itchiness with the skin. So those are some of the symptoms as well.
Okay, thank you. So in terms of the toxins that are retained in the body once the kidney is diseased, there's one notable toxin called urea that is usually retained in most people because it is majorly excreted in the kidney. So what are some of the effects that the urea toxin can have in the body of somebody who is ailing from kidney disease?
Yes, so as we know, urea is one of the major products that is excreted by the kidney. its accumulation may have implications on various parts of the body. You may have it accumulating within the brain tissue, leading to various symptoms. These may include confusion, disorientation, loss of consciousness. Occasionally, some patients may even go into a coma. The same urea may accumulate or rather affect the heart. So someone may have symptoms of cardiac failure. Usually the lining of the heart, which you call the pericardium, may be affected, and you may have fluid accumulating between the heart and it, and compromising the function of the heart. The same toxin may also affect the intestines, and patients may complain of abdominal pain and some discomfort. Yes.
Okay. So for that, it means that it's a constellation of many symptoms. So for kidney disease, it's not only about the kidney.
It's not about
the kidney is a vital organ, and it is able, it performs various functions, and with these functions, there are various different signs and symptoms that are relatable to them if the kidney is not functioning. Is that
precisely
right? Yes. So with that, with all this constellation of symptoms, as a patient, I would want to know: is this easily diagnosable, or what should I do in terms of how should I go about getting to see a doctor and getting to get myself treated?
As a patient, of course, you'll watch out for those specific signs and symptoms that we've mentioned, and the best advice would be to be seen by at least a doctor who's able to talk to you and understand what you have, and is able to relate and sort of get an impression of the underlying disease that you may have. In terms of what we as doctors do, once we get the impression that you may have that specific illness, we'll request for specific tests that will evaluate the kidney, that will evaluate the both in terms of its functionality and its structure, how it's made. We may also do some tests that we get what we call biopsies, where we get samples from the kidney to evaluate for very specific kidney functions. So the tests that we commonly do, those ones to assess the kidney function parameters. We may also do some tests to evaluate for illnesses or other specific illnesses. Some imaging modalities are available. So for instance, an ultrasound that will just check how the kidney is. A CT scan may be done also to just assess the structure of the kidney. So yeah, in terms of diagnosis, it's both what you as the patient will complain of, and what we as the doctors are able to take and assess, both in the lab and in terms of imaging.
Also, it's also very important to make our viewers understand that all this can be part of what we call at-home services, whereby our patients can get these tests done at the comfort of their home. So you can have one of our phlebotomists who comes to your home and take your blood samples, so that you're able to do this at your convenience, and especially for those who are immobile and they cannot be able to go to the various facilities. And in this era of COVID-19, the COVID-19 pandemic, most people are not able to go to facilities because of the fear of contracting the deadly virus. So it is something that can be done at the comfort of your home, and you're able to get value from it. And with that, we'll conclude our second episode on chronic kidney disease. Stay tuned for more in the next coming episode.